we're talking about connecting public health to the business sector. So one of the first questions is, well, why businesses? Well, as a key determinant of health, work plays an integral role in shaping people's lives. Of those, or on average, workers spend more than half of their waking lives working or engaging in work-related activities. So if you're trying to make an impact on workers, reaching them at work is one of the best things that you can do. And one of the primary ways that public health can reach out to the business sector is through what NIOSH calls total worker health. So what does total worker health even mean? So it means that in the past, in occupational safety and health, the primary goal was that everyone goes home the same way that they came to work. So we didn't want work to be a place where people are injured or made ill because of the hazards that they're exposed to. However, our vision for the future and our vision for total worker health is that everyone goes home in better health than when they came to work. So we envision a world where the workplace can be a place where your health is not only protected, but also promoted. So to achieve total worker health, we prioritize changes to the working environment before using educational or personal behavior change strategies. Now, that isn't to say that there isn't a place for educational or personal behavior change strategies when you're taking a total worker health approach, but it's just really super important to think about the working environment factors that impact worker health and how we can change those. So in this adapted hierarchy of controls for total worker health, it's really focusing in on the redesign, substitute, and eliminate sections. So how does this all come together? How does total worker health equal healthier workers and communities? So some of the top concerns that public health see when they conduct their community health assessments include chronic disease prevention and management, mental health, obesity, substance abuse, and things like that. And these same concerns are also shared by employers about their workers' health, because these health concerns can impact productivity, absenteeism and presenteeism rates. It can impact increased risks of being injured, which would then increase medical costs and things like that. So where does total worker health come into play? Well, it simultaneously addresses these community health and worker health concerns. Because total worker health integrates traditional safety practices with health promotion efforts, employers can see positive changes and improvements in things like medical costs, mental health, stress, work-life balance, and health behaviors, which then leads to safer, happier, healthier, and more fulfilled workers, which can then trickle down to spreading through to family members and then the community as a whole. So ultimately, this approach creates work and a work environment that allows workers to thrive. And when workers thrive, communities can thrive. So I wanted to pose a reflection question, and please feel free to put your thoughts into the chat. But thinking about your most, if you're in local public health, thinking about your most recent community health assessment, what areas do you think could be advanced by targeting businesses and its workers? Okay, so to see total worker health in action, we can look at Boulder County's total worker health success story. This story speaks to the success of total worker health, and to hear a little bit more about it, David is with us and he's going to share their story.
Thanks, Meadow. Appreciate that. Everybody can hear me okay? Sound okay? Well, many of you have heard this story before, and I have to give credit to HR professionals and public health professionals at Boulder County, HR Director Julia Yeager, benefits professional Emily Cooper, shout out to public health professional Linda Kopecki, who has since moved on. But what Boulder County did was they started with something that was mandated, breastfeeding friendly workplaces. And I know a lot of public health professionals, a lot of you out there are talking about lactation support and the importance of employers having breastfeeding friendly workplaces. They knew that, one, they had to have lactation accommodation spaces because the law was passed as part of Colorado state legislation, but they wanted to have a long view about their approach to Boulder County as a family friendly workplace. And so that long view included paid family leave, paid caregiver leave. It included an infants at work policy. But at the time, and we're talking now probably pretty close to a decade ago, I don't know if I have my years exactly right, but probably somewhere 2011 to 2013, there was an appetite from county commissioners making sure that all of Boulder County buildings were lactation accommodation friendly, were breastfeeding friendly workplaces. So that happened, you know, they made nice spaces and accommodating spaces in each building, but they knew it was part of this longer continuum. And the next step was to talk about paid parental leave before getting to paid family or caregiving leave. And so what they decided to do is analyze their FMLA data. How many people were leaving for FMLA on an aggregate basis, and how many people were leaving for parental leave? They found out that they had a workforce that was younger and a lot of people that were starting families, but they needed to do the data analysis to figure out, you know, and anticipate maybe what a paid parental leave, a paid family leave program might cost to the organization, to Boulder County as an employer. When they did that, after they did that, they presented the FMLA data to county commissioners, and they were successful in proposing a paid parental leave policy as part of this being a family-friendly workplace. Of course, we're all now familiar with paid parental leave or paid family leave with Colorado State Legislature, or Colorado State passing that through our open voting in November. But this was in 2017 time, 2018, where they got a paid parental leave program on the books. But Julia and Emily and their team at Boulder County were not done. They said, well, we really want this to be paid caregiver leave, paid FMLA. And so let's continue with, sort of piloting paid parental leave and see how we can expand that to be more inclusive and have a larger definition to include all caregiving. So a year after passing paid parental leave, they presented to county commissioners a proposal to broaden the definition from just parents to include caregiving. And even with an explanation that if you're caregiving for a neighbor, a cousin, a family member, and are able to I'll say loosely prove that you're the caregiver and go through the process of getting that approved through your supervisor, that would count towards being having paid leave as a caregiver as well. So they really broadened the definition from paid parental leave to paid caregiver leave. And then the last piece of that was piloting an infants at work program for new parents. So coming back to how to support particularly new parents, having an infants at work policy, a written policy that was, sort of allowing for new parents to bring their new child into the workspace for up to, the first 6 months or potentially up to the first year. Once again, there's sort of a process in place with forms and supervisor approval that they'll go through. I'm not going to get into the logistics of each of those things, but I think this really highlights an example of the continuum and this sort of long-term strategy over the course of, we'll say 8 years, going from lactation accommodation, breastfeeding friendly workspaces to paid caregiver leave and an infants at work policy, something that they had a vision for and that they were really able to accomplish this sort of big family friendly total worker health initiative. And they were patient and persistent, which is always my advice to people when they're looking at implementing a new policy or program. So that's the example I'd like to give here. Thanks, Meadow, for letting me share.
Awesome. Thank you so much, David, for sharing that example. It really just speaks to when you focus on implementing policies and practices and programs is what really Total Worker Health is focusing on. You can really make a difference and impact worker well-being. So this slide is just another way to make a connection between your public health initiative and Total Worker Health. It points out all the different opportunities that you have to address worker well-being when you take a total worker health approach. So initiatives such as tobacco cessation, diabetes prevention, family-friendly workplaces, paid leave policies, flex policies, they all fit within a total worker health approach. So let's say, for example, your public health department's working on an initiative for lactation accommodation. What bucket or box do you think this would fit into? Well, lactation accommodation would fit into built environment supports, because by building lactation facilities in the workplace, businesses are supporting their working mothers. It can also fit into policies and healthy leadership. Are there policies in place that are supporting working mothers, and does the leadership reflect that support? So what I'm really just trying to get across here is that when you're making a case for whatever public health initiative you're working on, say for example, the lactation accommodation, or it can be family-friendly workplaces, when you're in front of a business and you're making that case, you are taking a total worker health approach. And later on in this training, you'll actually get an opportunity to really reflect on your current initiatives and what you're working on and how that will fit into total worker health. So focusing on objective 2, what are the best methods for reaching out to the business sector? This next section will focus on who to reach, when to reach, and how to reach. So first and foremost, when you're thinking about who to reach out to, it's important to remember that size matters. So when thinking about the individual you're going to first contact, it's important to ask yourself, well, what is the size of the business that I'm planning on reaching out to? So if the business is small, which is generally businesses with 50 or less employees, in this case, you'll typically reach out to somebody in an executive leadership position, such as a CEO or a COO. Because typically small businesses don't really have the capital or resources for, say, a designated wellness team. However, for those mid-size or larger companies, they'll typically have more human and financial resources. So in this case, you would reach out to an HR director, a health or safety director, or wellness and well-being coordinator. So now moving on to when to reach out to the business, it's important to remember that timing matters. And this timing isn't based on when public health wants to reach out, but when businesses will be most receptive. It's really important to first and foremost understand the pressures of businesses and their business cycles. So for example, if we're thinking about a business's fiscal quarters, in fiscal quarter 4 or the end of the year, this is a pretty intense time for businesses. They're focused on trying to hit goals and targets, which can definitely make them less open to hearing out new ideas and taking on new projects. However, if it's quarter 1 or the beginning of the year, this might just be perfect timing because businesses are more forward-thinking and more expansive. They're working on new budgets and new initiatives. And so in this case, they'll typically be more willing to hear out your new ideas. It's also important to consider the seasonality of the business. So let's say, for example, it's the ski industry. Would you reach out to them during the winter? Or what about a construction company in Colorado? Would it make sense to reach out to them during the summer? No, because it's their peak season. This is typically the time where this is the time where they are making the most money. So instead, it's recommended to reach out during their off seasons when they have more time and resources to hear you out. You should also consider the timing of events or conferences. Is there a conference or event going on where you can reach multiple business leaders at one time? It's always easier to access clusters of people. You can also consider the timing of hiring events. When are there big hiring or recruitment fairs within your area that are for businesses? It's a great way for businesses to approach prospective employees if they can talk about total worker health. In addition, you can consider the timing of opportunities for businesses to receive community recognition. And for our Colorado folks here, you can think of an example would be the Governor's Award, because businesses really like to be recognized within their communities. So timing your outreach activities with these deadlines can prove to be helpful. Lastly, this may take a bit more research, but you can also look into a business's corporate social responsibility agenda and when they're planning on reaching out to stakeholders. This would typically be for those bigger companies though. And there's a lens in of corporate social responsibility that focuses on taking care of employees. So timing your outreach activities with this can prove to be helpful because it allows businesses to be able to add total worker health to their conversation when they're reaching out to the stakeholders. So as you can see, there are a lot of timing situations that should be taken into account when you're reaching out to businesses. So really the key is aligning your outreach or public health initiative with times that businesses will be most receptive. And during a conversation with HealthLink's program manager, David, he said, what you really want to hear is, this is perfect timing. Because when you hear this, you know that they're ready to take the next steps because you're making their life easier. What you don't want to hear is, well, can you call me back in a couple months? Because that means you'll just have to have this conversation all over again, and sometime down the road, they might already have something on their radar. So what we're really looking for is for them to say, wow, this is perfect timing, because as David says, that's when synergy happens. So now moving on to how to reach out to the business sector. So really focusing in on what methods work best when you begin the process of reaching out. So you can first think about meeting them where they are. You can attend a conference or an event for businesses, HR, or occupational safety and health professionals. When it's safe to do so, you can also set up a booth at a conference. You could also partner with a chamber or a small business that's hosting a conference or event. Also, along with going where they are, you can engage with businesses over social media. We live in a digital world, so liking or commenting on posts shows that you're interested in the business and the work that they're doing. Lastly, and most importantly, is making sure not to overwhelm them with statistics. Public health definitely has the tendency to lead with stats, but in most cases, especially when you're reaching out to businesses, this will definitely just get glazed over eyes. What businesses really want is for you to give them an opportunity to speak and to really understand where they're coming from. I do want to say that this doesn't mean that coming prepared to the conversation with statistics is a bad thing. It's actually a good thing to do. It's just not the best idea to lead with statistics. And David is going to share another example with us about what can go wrong when you lead with statistics.
Thanks, Meadow. So I'll use an example again from family-friendly workplace conversations. I won't name the community, but as many of you are aware, a lot of the original family-friendly workplace funding came out of child maltreatment and child abuse prevention dollars. And one thing we have in public health is we have really great data, and we really, we pride ourselves on having clear and consistent data when possible. So I was at a presentation to address a bunch of business leaders at a bank setting for a luncheon several years ago, and we had someone from public health there, and we hadn't really talked much beforehand. This was really at the start of some of our family-friendly initiative work in 2014, 2015, and the presentation focused on some very challenging child abuse statistics that this community was having, some reports of child maltreatment and abuse. And you have to remember that these were business professionals that came into the room, they grabbed a lunch, they really didn't know exactly what they were planning for, and they were sort of hit in the face immediately with very challenging statistics to hear. Now, I'm not saying that those statistics aren't very important to share with the business leaders and with the community. However, there's a place and a time and a format to do it. What we found from feedback is a leave behind that had all the statistics to support our work would have been a lot more effective than leading with child maltreatment and child abuse statistics during someone's lunch hour vegetarian or roast beef sandwich. We ended up having people leave the room being even more turned off to the entire family-friendly conversation because they just weren't anticipating that being what they were hit with upon sitting down as a luncheon. not to discredit, all of the important work that you all do and how important these statistics are. But I think in addition to the size of the organization that you're talking to mattering and the timing mattering, the content that you're presenting, especially upon first meeting with the business community, until you've established some trust, is content matters as well. That would be my third point here. With size matters, timing matters, and content matters too. So that's the example I like to give there. We've learned a lot in Family Friendly since those early days and conversations. And once again, Meadow, thank you for giving me the opportunity to share.
Awesome. Thank you, David. Yes, content definitely matters. And in a few more slides, you'll see that words matter as well. All right. So another how to reach is through business intermediaries. And these includes chambers of commerce, health providers or insurance companies, community nonprofits working with businesses, and so forth. And these business intermediaries can help disseminate information to its members for you, provide contact information, and they can also boost credibility and help build trust. Also, when you're particularly reaching out to chambers of commerce, it can also be helpful to look into what existing committees are already at the chambers of commerce. So for example, the Chamber of Commerce may already have a healthcare committee, so you could also reach out to something like that. So really, this business intermediaries really allow for having a trusted partner connect you with the business. This can prove to be really valuable. Before even looking at business intermediaries, it can also be helpful to just look at your existing partnerships. Are there any of your partners that you're currently working with businesses as well? For example, say you have an existing relationship with a community nonprofit that you know that works with businesses. You can always piggyback your efforts off of theirs. So the next how to reach is through peer-to-peer networking. Businesses want to hear and see what other businesses are doing. And you definitely know you've done your work if you can build up to a B2B or peer-to-peer conversation. It's definitely easier for public health to let the conversation unfold organically, as opposed to having to convince everyone that you come across. Because in this way, you can let the business take lead in the conversation while you're there to guide it. And one way that you can build a peer-to-peer network is by creating and cultivating a business coalition. This can help to share promising practices and discuss collaborative opportunities. It can also help you spread the word about your total worker health by providing established spokespeople for your initiatives. It also allows the business to partake in or share in the decision-making over the process of your initiative. And so I just wanted to pose another reflection question. Feel free to put your ideas into the chat, but what are some other ways that you think that you could cultivate peer-to-peer networking? So the next how is direct to business communications. So before making contact, it's essential that you do as much research, background research on the business as possible. Check out their website, annual reports, social media, or find them on business-oriented websites. Also, if you've already narrowed down the specific business that you're planning on reaching out to, it can also be a great idea to learn about their industry and what kind of work that industry is doing. Because coming to a conversation as prepared as possible can definitely only help you. It also demonstrates to the business that you're interested in who they are. So next, when making contact, Communications 101 says that people need to hear a message 3 times in 3 different modalities. And this is typically visual, written, and spoken. So for example, you could talk to them on the phone, send them an email, and share an infographic with them. Additionally, be mindful of the reading level you're communicating at. It's definitely not about sounding smart, but getting your point across in the most effective and easy to understand way. And then similarly, and most importantly, I would say, is cut the jargon. One of public health's biggest challenges when communicating public health to non-experts, and in this case, businesses, is the use of technical jargon. And within the public health field, it definitely has its value, but when we begin communicating outside of our circles, it's critical that we translate our jargon into a language that will resonate with that target audience. So, for example, I know we've been talking a lot about total worker health today, but even total worker health can be too jargony. A lot of people don't know what it is. So when you're first reaching out to businesses, it's definitely recommended to not just throw it around. And then also, I just wanted to share this infographic with you. It is from Public Health Reaching Across Sectors Toolkit on communicating with non-experts. It shows their evidence-based criteria for cutting the jargon and finding winning words and phrases that will be memorable and motivating. So first, feel it. Does the word or phrase that you're using create an emotional reaction in the person that's listening? And this really focuses in on using the active voice. Next is believe it. Will the word be familiar or easily understood by the business professional that you're working with? The next one is see it. Does the word create a mental image? Can your business contact visualize what you are saying? This will definitely help make the message more memorable. And then lastly is say it. Will your contact be able to retain and repeat what you're saying? Your contact's definitely going to go back to the business and share what they've learned. So it's important that they're comfortable repeating what you've said to them. So lastly, and similarly to cutting the jargon, is it's important to remember that words matter. The words and terms that we use matter because public health and the business community speak two different languages, and this can definitely become a major barrier if you let it. So therefore, keeping in mind that you're reaching out to them or approaching them, it's important to use words and phrases that resonate with them best. So this graph shows the difference in public health and business terminology. It's from the report, Good Health is Good Business. And it really just shows the different terms. So for example, when you're reaching out, you can use the word eval, or instead of using the word evaluation, you can use the word assessment. Or instead of the word outcomes, to better resonate with your business contact, you could use the word benchmark. So it's really just focusing in on being nimble enough to use different terms and different phrases and things like that. And though not in this table, another difference in terminology that's important to note is that businesses don't think in terms of programs like public health does. They think in terms of problems and solutions. So being able to frame your public health initiative into a problem or solution mindset will better resonate with the business contact that you're working with. And then another thing to consider around terminology is using industry-specific terminology. So let's say, for example, you're planning on reaching out to a construction company. It can definitely be helpful to do a little background research on the terminology that the construction industry uses, because it may not be, even though there's business communication, an industry might also have their own specific language that better resonates with them. And I just wanted to leave you with this. I was watching a TED Talk with Keisha Brewer, a strategic communications professional and CEO of the PR Alliance LLC. And she said something that definitely stuck with me. And she said, a lot of us have heard the phrase, it's not what you say, but how you say it. She said to think about the person who told you that and tell them that they lied, because what you say is just as important as how you say it. And that really just speaks to the fact that words do matter. So now I just wanted to move on to some practical recommendations when you're reaching out and communicating and working with businesses to make sure that they're memorable. They all start with the letter P. And those first two words, as you can see, are the ones that David already said, patience and persistence. So first, patience. Patience is necessary. Building partnerships takes a long time, and I know this definitely probably isn't new to public health because, as we know, public health initiatives definitely take a long time. Next is persistence. Persistence is key. Generally, you're working with executives or human resources, and these individuals have busy schedules and lots on their mind. So it's important to be consistent, to follow up as much as needed, and then also don't expect them to respond right off the bat. Persistence also means being okay with hearing the word no. You'll probably hear it a lot, and persistence will get you through it. Third is preparation, and this really goes into that background research because preparation shows that you care. It begins by making sure that you go into the conversation with as much background of the business as possible. It also means to prepare to change things around if your initiative doesn't necessarily fit with what the business needs. Remember, the business knows best, so be prepared to adapt or pivot if needed. Fourth is practice. Practice what you preach. Walk the talk, role model. It's important that you're also practicing employee well-being within your own agency or your organization. Businesses will ask you when you're reaching out to them, well, what are you doing internally, or what are you doing around total worker health? And you're going to want to have a response, and you're going to want to be able to provide examples. Lastly, partnership. The main purpose of connecting public health to the business sector is to build strong partnerships. And to build those strong partnerships, it's important to involve the business as much as possible throughout the entire initiative. And then also, as I've said before, let the business do most of the talking. Yes, we have the health expertise as public health professionals, but they know their workplaces and employees the best. So now moving on to objective 3, we've talked about it a little bit about the words matter and things like that, but now we're going to move on to how to build your case. So if you're going to have a message that you can relay to a business, this framework should be able to help you. So I'm using the Public Health Reaching Across Sectors narrative structure, which is a useful method for communicating with maximum motivating power. I adapted it a little bit to build your total worker case or your public health initiative case, whatever you're using to speak to businesses. So these guidelines can be adapted into a 1-minute message that can help you when reaching out to businesses, and the narrative flows in order of people, goal, problem or need, solution, and listen. So for people, who are the people involved and what are you doing? This helps the business understand your role. Goal, what are the goals that you're working towards? And in this section, you really want to emphasize those shared goals. This is where background research about the business can be helpful. And then if you are making your total worker health case, you both care about the health and well-being of employees. Problem or need. So what problem stands in the way, or what need can you touch on? For example, the business needs to keep their employees healthy and safe because they're the business's most important asset. And then solution. What is the solution and how will it benefit the business and its employees? And businesses, it will really resonate them if you can demonstrate some tangible benefits that they'll see. Lastly, listen. Listen to the business's needs and concerns. This is key when you're working with businesses. You want to let them do the talking. So next, I'm going to show an example of a 1-minute making your case for total worker health.
Here's an example of making a case for total worker health. Our health department is committed to improving the health of our communities through outreach to businesses. We are dedicated in our mission to improve the health, safety, and well-being of workers. Our agency understands that employers are critical to improving public health through workplace initiatives, addressing chronic disease prevention, mental health, safety, and healthy behaviors. Total worker health provides an approach for fully integrating workplace programs, policies, and practices that show a business is focused on having the healthiest and safest employees possible. This approach boosts job satisfaction, morale, and productivity, helping businesses recruit and retain the best talents. How can we help your organization solve your greatest concerns about the health and well-being of your workers?
All right, so now that we've heard the example, I made a little breakdown of that example in the narrative structure. So for people, who is involved and what are they doing? Well, the health department is involved and they're reaching employers to improve health. Goal, what are the shared goals? So the business and the health department are both dedicated to improving the health, safety, and well-being of workers. For this particular example, we focused on need. So what is the need? Well, the need is to improve worker health behaviors and outcomes. This message also highlights that public health is recognizing that they need businesses to really make changes. And then solution. What is the solution? So this was a total worker health case. So the solution is total worker health. And then how will it benefit employers and employees? By boosting productivity and job satisfaction, and then helping businesses recruit and retain the best talent. And then lastly, listen. By ending with a question, you're giving them the opportunity to share with you their greatest concerns. So now really focus in on letting them do the talking.